All right, we're going to talk about something we've talked about several times in the past few months. We've been reporting on our kids being in crisis, and we've been tracking a dramatic increase in the number of our kids across the state of Minnesota being dropped off at emergency rooms because they have nowhere else to go for their mental, emotional, and behavioral issues. And Kent has a difficult update to share with us tonight.
Now, Jana, as first reported by the Star Tribune, mHealth Fairview has converted this ambulance garage you see behind me outside the emergency room at its Masonic Children's Hospital into a shelter for kids who have been stuck there for weeks. Now, they didn't come to the ER for a medical emergency, they say. Most didn't even come for a mental health crisis. They tell us more than 2/3 of these kids were dropped off by residential facilities and group homes and have long-standing developmental and behavioral issues that sometimes lead to violent outbursts. I sat down with a leader at mHealth Fairview to find out how they got here.
I think of it as the least of bad options.
Lou Zeidner is Director of Clinical Triage and Transition Services for mHealth Fairview, but says for weeks there's been no transition for 8 kids ranging from about 10 to 17 years old being cared for in this converted ambulance bay.
They have no reason to be in the hospital other than they are not safe to discharge. The traditional emergency department room is relatively small. Very rarely does it have a window. And so what we've tried to do is to create more space.
So if you walk in there, what do you see?
Well, at one end of the room you see 3 garage doors, and that creates some natural light for the space. The floor is concrete, the walls are concrete, and then spread throughout the space are some beds, and then also some chairs, more like recliners.
Frankly, just the thought of these kids in crisis living in a garage is hard to imagine and stomach. Why not somewhere else?
I think there are 2 answers to your question. The first is that we are very full. So folks say, why don't you move them somewhere else? There isn't another place to move them. The second is we didn't anticipate, nor do we think it's appropriate, that these kids are with us. The hospitals are being misused.
That is a matter of serious, grave concern for everybody at the state.
Nirja Singh is Clinical Behavioral Health Director for the Department of Human Services and says the loss of licensed children's residential facilities is part of the problem. Prior to the pandemic, there were 122 throughout the state. Now there are just 106, translating to 413 fewer beds. And she says that's just on paper. In reality, capacity is even lower.
Workforce shortage is really hitting our residential providers. They do not have staff who can provide supervision as well as treatment to these children.
Should counties be dropping children off at the emergency room if they're not really suffering from a medical emergency?
No child should be dropped at emergency room if they do not have the medical need. So that is just not a healthy ethical practice.
She says in November, DHS created an intensive unit to address this problem, and they received $2.5 million in temporary emergency funding to do what they can in the short term.
The state is working with our current residential providers to provide funding to immediately start accepting these children from emergency rooms.
I am hopeful that that's accurate. I'm not, frankly, seeing the evidence yet, but I'm really not looking for who's at fault here. I'm really looking at a systemic problem.
It feels like kids that nobody knows how to take care of, and so they're getting shuffled around.
I would agree. And I would say the most frustrating part of this is that we watch vulnerable children get worse over time.
Are there any things that you're finding that are signs of potential momentum?
In fairness, no. I think there is a lot of discussion about better ways, but that's a very long process. And every day I walk into the emergency department and I look in the eyes of a child who's been there for 46, 47 days, and I say that process is too slow.
Now, Lou says the 8 kids there right now are being watched by 6 to 8 nurses 24 hours a day, with psychiatric and medical professionals coming through daily as well. And even though it's only been like this for 2 weeks, since September they have taken in 145 kids like this. Before that, they only averaged 1 or 2 a month. So you can imagine the strain that puts on everything and the concerns that that presents, Jana, when it comes to if you're going to be bringing someone to the ER and the staffing crunch that they have.
Right. And I really appreciate that Lou did that interview with you and was transparent about the problem, not saying, oh, no, we're not going to talk about that. And he brought up funding. And we've talked about so many groups talking about our kids' mental health, going to the state legislature saying, are you going to do anything?
There has been some talk about that, some bipartisan support for this in general. This is, as we've talked about, a whole lot of layers involved. This is one subset of kids. So where all of that money ends up going and how it ends up being addressed is the big question here. We'll see how that plays out in the legislature. Everyone's going to be watching, and they do believe that it'll take a whole lot more than $2.5 million, which is a very temporary fix for just these few kids right now. But this is a problem that's systemic, and they really need to, they tell me, get the residential staffing up, and that's going to take a lot more political will.
Well, I think seeing images of that garage should do something. Thank you, Kent.